this is McKayla Davis, and this is my performing in basic first aid simulation video. I'm going to start out with fractures. Got a muzzle. First you want to muzzle your patient. Put your animal on top of a blanket. For the makeshift stretcher type, if you would need so anybody can pick up the sides and help the animal. If they had a fracture, like say it's in the leg, you would want to do like a modified splint type bandage. And to show one, I'm going to do, just if you were in an emergency situation or just first aid waiting on a doctor, you could do a modified bandage, doing it with the layer of cast padding, going distal to proximal, applying it, and my secondary layer of my elastic gauze. Distal to proximal. And of course you do your stirrups, you know, place underneath if you needed to twist and tie so that way your bandage doesn't fall down. I'm going to do my vet wrap. Work my distal to proximal way. Never do a bandage proximal to distal. Always work your way up. Okay, we're going to finish out this roll. And this way, if need be, you could do like a spoon splint or something if you needed to keep hold of the animal's modified splint bandage. You could also do, which I like to do, at least for the last wrap, a piece of tape. That way to let whoever's working on it or your doctor know who applied it, when they applied it, so you'd know when it was last done. That would be a bandage. If you needed to apply a tourniquet, if need so, here's mine. I'm going to loosen it up. Say we were bleeding. Arterial bleeding, you want to do it proximal to the wound. For venous bleeding, vein bleeding, you want to do it distal to the wound. So if the wound was here and it was arterial bleeding, you would want to go proximal, like so. And tighten it. If it was distal, which means it was venous, you would do, if the wound was where my tape is, you would do it below, like so. So, arterial, venous, if my wound was here. If you're using a tourniquet, you want to loosen it for 1 minute every 10 minutes. So every 10 minutes I have on the tourniquet, I need to loosen it for at least 1 minute at a time before I continue using it. Alright, we're going to talk about bleeding. I'm going to remove my bandage real quick before we talk about bleeding. Now that tourniquet goes along the way with the bleeding more so than the fracture. Once again, you want to loosen it every minute for every 10 minutes for 1 minute if using a tourniquet. You want to keep it, like I said, above. For arterial bleeding, you want to do it above proximal, to the wound. If it was here, you do distal to the wound. Okay. Burns. chemical burns such as acid burns, motor oil burns. You could do things first aid wise. You want to, of course, rinse them with lots and lots of water. If we were burned, say like so, we would want to at least get maybe a sprayer if you're accessible to one, and just rinse that burn. A good amount of time, I would say at least 20 to 30 minutes. And if we do have a burn on our body, even in our face, you want to definitely apply an e-collar. That way the animal cannot get to the burns if they're back and on the body, or if so they're on the face, they can't use their back legs or their front legs to scratch or itch that area. A severe burn, such as a 3rd-degree burn, it destroys the entire thickness of the skin. You could do cold applications, such as ice packs. You do need to watch out for hypothermia if you are using ice packs for a burn. You do not want that baby's temperature to go from way up high to way down low really quick, because that could be really severe as far as hypothermia goes. And it could also stop the progression of the burn healing. Also, severe burns, you would want to do oxygen therapy, especially if like a cough is present. You would want to do fluid therapy, definitely, if that baby has burns, the animal has burns. And wound management. A lot of times we use Silvadene cream on our wounds, especially burn wounds. It's got a cooling type agent as well, or at least I feel like it does if I've ever had to use it. We have had incidents where if an animal has been burned, like urine scald, or just burned by chemical, and their skin ends up sloughing off. Silvadene typically helps. It doesn't heal it up fast, but it typically helps that healing process. Okay. Choking. If your animal is choking, you would, of course, if there is anything patent or anything in the way of the animal's in the esophagus or in the throat, you would want to pull it out. If your finger, if possible. The Heimlich maneuver, there's 2 ways you can do right above the rib cage and apply pressure, and that pressure would cause air to form up out of the mouth to get the object to come out. Also, you could, if possible, go right where right below the rib cage and that would apply pressure to come up through the esophagus and help push out whatever object is causing your animal to choke. Heat stroke. There are many signs of heat stroke: dyspnea, open mouth breathing, drooling, just having a hard time in general, lethargic acting. They could have a heat stroke from being left in a car for too long. That is definitely a big reasoning for heat stroke. If an animal comes in that has had a heat stroke, you of course want to get its oxygen going back. You'd want to hook it up to an ambu bag, or you could hook it up to the oxygen machine if need be. You would want to keep a good look at its breathing rates, hook it up to your oximeter machine. You could apply ice packs to help with the heat stroke. Once again, you do want to watch out for hypothermia. If they're at a very high temperature and their body temperature goes down really low, really fast, hypothermia is a big thing to watch out for. And of course, you want to, like I said, keep evaluating, especially if we're on fluids, evaluate the heart rate if need be. Shock. There is 2 types of shock: compensatory and decompensatory. And decompensatory is definitely the most severe. There are many ways to check if your animal is in shock. You can check your temperature rectally, under the ear, with a rectal thermometer. You need to check the respirations using a stethoscope. Check the heart. Listen for the heartbeat. You want to listen to the lungs, definitely, and see how their respirations are going. Watch the respirations. Make sure they're breathing, not open mouth breathing only. Pulse, femoral pulse, palpating the animal's leg. Mucous membrane, you want to check the color, brick red, pale pink, white, anemia. You would want to check the urine output. If the animal is staying with you, ask the owner. You definitely want to check to see how much urine they're outputting, what it looks like, even the smell if necessary. The mental state is also a big thing. You want to check their mental state of mind when they're in shock. There's many types of shock. There's hypovolemic shock, which is low blood volume, cardiogenic, related to the heart, congestive heart failure, endotoxic, toxicity to the body, such as rat poisoning. That could be a major setback. Back to the poisoning, that's another basic first aid. You would want to definitely, once again, check the mucous membranes, check the temperature, make sure it's not elevated or below normal range. If the animal has ingested anything toxic-wise, you would want to contact poison control, make sure there's not an antidote they can get up ready for you to help with the animal who has ingested anything such as rat poison. We have a lot of animals that come in who have ingested, rat poisoning. You want to find out when they ate it, what they ate, disposition, what kind of signs are they showing that they've eaten it. If we have something in our eyes, if something, gasoline or anything has gotten into our eyes, you definitely want to rinse their eyes out with saline for 20 to 30 minutes, if possible. Anything topical, we've had cases where parents have put Advantix on cats, and it has caused them to go down fast, and we have to bathe them and rinse repetitively to help with the topical poison. Gasoline, if it's gotten on the baby, you would want to soak in vegetable oil, or you can soak the animal in milk. If they have ingested something like such as rat poisoning, around here we use a lot of hydrogen peroxide to induce vomiting in the animal. There's other ways. There's salt, but they don't recommend it. Apomorphine is the most reliable, and that's used for the central nervous system stimulation to help with the emetic of the vomiting of the animal if we were to go into if we were to ingest something and we had poison. They also use charcoal to help with the animal if they have ingested anything in their body. Alrighty, and last but not least, seizures. Very, very, very scared me the first time I was involved with the seizure. I was always told that when an animal goes in seizure, the best thing you can do is get them in a quiet place. Not so much a bright place, dark if possible, but you still need to be able to see, and wrap them in something. Make them feel more calm, comfortable. Talk to them. Watch your face, hands, anything. They can bite while they're having a seizure, and they don't know what they're doing when this happens. Medication, you can put an animal on medication for seizures, such as phenobarb. That's the one we use a lot around here, is a phenobarbital. Blood work is necessary to do before your animal is put on phenobarbital. There's many causes that can cause a seizure, other than they're just prone to it. There's anemia can cause a seizure. Once again, poison can cause a seizure. A brain tumor that is developed in your animal can cause a seizure if older or even younger if a brain tumor has developed. But say my animal's going into a seizure, I would want to go to the darkest place if possible around the clinic, wrap this baby up, and while they're seizing, try to talk to them, but also keep my body self back to make sure that I don't get bit or harmed in any way while trying to help the animal who's coming out of a seizure. And that is my first aid simulation video. And also I did watch the videos to demonstrate on how for the simulation video. The basic first aid video.